So I'm at the World Hope International headquarters in Sierra Leone, in the city of Freetown, and I'm here with Saidu Kanu, a very dear friend. He's a country director for World Hope International, and he's agreed to talk to us for a few minutes. So Saidu, thank you so much. Tell us a little bit about World Hope.
Hi Kanja, it's good to see you after a very long time. We miss the students. Because of COVID, the students have not been able to come. Well, World Hope International has been in Sierra Leone for the past 20 years. We started as a relief organization to respond to the needs of displaced people and refugees during the Civil War. But in the past 10 years, we have gone into development and we have expanded our portfolio to water and sanitation, health, education, livelihood, and other innovative stuff. I also know that for the past few years, we have partnered with WHI University that will be bringing students and faculty members to Sierra Leone to work with us in several innovative projects like the Kelly test strips, the mushrooms, and several other things. We enjoy the partnership with WHI University, and I think a few months ago, I had the privilege to visit WHI University and met with the students, went to see the work that they were doing in preparation for their visit to Sierra Leone this January, but unfortunately they were not able to come. I hope that we'll have COVID behind us and they'll be able to come sometime in the very near future.
Sure, thank you, Saidu. We are all pretty excited about that and hopeful that August is going to work out. So what, can you tell us a little bit about the primary areas in which you work? What are the projects that you're most proud of?
Well, we have our flagship programs. We have the water and sanitation, whereby we provide clean water to thousands of people in rural communities, in schools, and in health facilities. We also have our protection program, whereby we work with survivors of human trafficking, survivors of sexual and gender-based violence, and we work with women to promote women's empowerment in Sierra Leone. Sierra Leone is mainly a male-dominated society. So working with stakeholders to make sure that we improve the life and quality of women in Sierra Leone. Our other program has to do with livelihoods. In Sierra Leone, poverty rates are very high. So work in those rural communities, provide resources, provide capacity building, and work with them to not only to be able to grow food, also to make sure that they have the necessary skills to grow the food so that at the end of the day, their harvest may be plentiful. So we have those lively programs, also part of our flagship program. We also have our health program. The infant mortality rates in Sierra Leone, they are very high, among the highest in the world. So we are working with Emory University and Crown and ICAP and Focus 1000 to determine why are under 5 children dying in Sierra Leone. So we have that program, it is called CHAMPS. That's also a flagship program to be able to determine the causes of death and how can we inform government in terms of policy, in terms of training, so that they can train the midwives, they can train the nurses to improve the situation of under 5 children, so that the incidence of death among under 5 children is drastically reduced.
That's wonderful. Thank you so much. I know that we really value this collaboration. It's really important to us, and working with you personally and working for your entire staff has been an absolute privilege. So thank you, and I'm hoping that we'll be able to travel there in August.
I hope so. I look forward to seeing the students in August.
Yep, thank you.
Okay, thank you, Kanja. Say hi to